Hi, everyone. Sorry, we're just starting the recording. Thank you so much for joining Lutheran Services in America for our first of many conversations on policy issues. Today certainly will be focused on workforce, but before we jump in, I just want to introduce myself and give you a little idea of what we'll be doing today. So I'm Sue Polis. I am the Vice President of Government Affairs and Public Relations for Lutheran Services in America, just coming up on my 1 year anniversary. And this Capital Conversation series is really meant to ensure that our members have a great way to be in dialogue with folks leading a lot of the different work and efforts in DC related to federal policy, both legislatively and also regulatory agencies. So I'm excited to have you all with us. We have a great lineup. So, of course, today, this is all about building a workforce for the future, trends and practices shaping policy. And so before we dive in, I'm going to ask my colleague Bill first to lead us in a poll question. So, Bill, do you want to go ahead and bring that up? So our question is, having attended this webinar, well, you are attending it. How prepared do you feel now to advocate for measures to help address the workforce crisis? One, very informed through five. I'm sorry, one, very uninformed through five. Very informed. Give you one more minute. And welcome to all those folks joining. Thanks for sharing your name and location with us in the chat. Please continue to do that as you complete the poll. Okay. Bill, are we close?
Looks like we've got about 3 other people who haven't participated, although those could be us.
Okay. All right. Well, it looks like, okay. It looks like we have about 9% of folks feeling very informed, 36 feeling somewhat informed, and then the remainder feeling either a little agnostic or somewhat or very uninformed. So excited to have this timely conversation today, and with right a diversity here of folks feeling that will uh, that will have some good content today. So before we jump in to our distinguished panel of speakers today, which I'll introduce as we move through the program and allow for some Q&A and dialogue with many of you. We want these to be interactive. I want to just start by sharing some context with you. And so I'm going to ask Sarah to pull up our slides. We could take down the poll if we haven't. And Sarah, can you bring up our slides? Wonderful. Thanks, Sarah. So I wanted to just share a little bit of context about how these workforce issues are showing up with an emphasis on Lutheran Services in America members, right? So let's go to the first slide, Sarah. And this slide really, I think gives a great picture from recent conversations with members. One of the most consistent themes we've heard and continue to hear is the need for workforce solutions. And this really tells the story, right? Lack of available workforce is the primary reason social ministries are seeing declines in revenue and impact. That's what they're telling us. As you know, the US workforce is changing with a shift and greater percentage now in health and supports for a variety of reasons, right? Boomers retiring, that'll continue this trend, as well as things that were unexpected, right? The exit of a lot of our workforce through COVID. And so these are creating some good headwinds our members have been facing now over the last couple of years, putting more pressure, right, on competition on already high demand for skilled workforce in health and social supports. And then moreover, right, we know we've been working for the past year or more with CMS to weigh in on the skilled nursing facility staffing minimum, which again creates more pressure in care for especially older adults, but across all of our service lines. Next slide, Sarah. So, you know, strengthening our advocacy efforts is a top priority. And based on key informant interviews, some with folks joining us today, we've really heard about access to care as well as whole person health, including behavioral health. And so that's really helped us identify sort of what we're calling our three initial high priority issues as it relates to access to care, Medicaid, as I say, right? Both health and behavioral health with services and supports, focused on payment, reimbursement, flexibility through waivers and demonstrations. But the workforce, right, has to be in place. And of course, reimbursement is a part of our ability to recruit and retain workforce. So we see those as very aligned issues, along with whole person health, with a focus on housing and health as we think about really quality, safety, affordability, and accessibility. And so, of course, today we're going to go a little bit deeper on workforce, and I want to, next slide, I want to just share a little bit about, right, how we're approaching this and why those core issues, right? Because this is really about uniting our members around shared needs through policy. Certainly cutting across service lines is a significant priority because we serve such a diversity of members in so many areas, and certainly workforce is something we see across all of them. And then certainly today, right, we have two wonderful member organizations and representatives with us, making sure your subject matter expertise is being brought to bear in conversations with stakeholders, decision makers, as well as your peers. Next slide. And of course, I just want to spend another minute. This is a graph, right, that illustrates, yes, the significant headwinds also with our declining U.S. population, right? We talked about on the earlier slide, the workforce challenges within health and social services, but it's in this broader context, right, of a broader labor shortage. Again, impact being felt across service lines, correlating with other declines, right? 1/3 of the U.S. population without a primary care provider, college enrollment declining. And so as we've been working through our strategy development process to support our policy agenda, next slide, we're thinking about this across really a continuum, right? We know that recruitment and retention are key, including, but not singular, right? It also must include strengthening the pipeline of workers, along with readiness to fill the necessary roles in the workforce, right? So there's also unanswered questions, right, about the impact of AI and how that will shape the future of workforce. And also making sure that this work that we do at Lutheran Services both leverages our unique faith-based voice, right, but in this complete context of a holistic framework. Next slide. And so, of course, there's legislative issues. This slide illustrates a couple of the priorities Lutheran Services in America has been working on, but I'm not going to say a lot about this because we have speakers that'll cover this in more detail. Next slide. As well as the regulatory agencies that that have a lot of engagement and a lot of active roles, right? From the Department of Labor to Health and Human Services, both CMS as well as HRSA, or the Health Resources and Services Administration, to Homeland Security, right? So there's a lot of accountability across a wide variety of federal agencies. And so today, that's why we've made this conversation a real priority. And so now, Sarah, if we could take down the slides, I'm going to go ahead and introduce our speakers. We have four really distinguished, knowledgeable speakers with us today, who are going to give you a lot more information about legislative vehicles, along with a couple of snapshots of members and their efforts. So first, we're going to be hearing from Stephanie Badger. Stephanie is a senior vice president with the Nichols Group here in Washington, D.C., and she has been co-leading a group that we've been very honored to be a part of, the Healthcare Workforce Coalition. Stephanie's going to tell us a little bit about some of the legislative and regulatory efforts underway. She'll talk a little bit about the issue, the problem, and also speaking to some of the avenues that we're pursuing to remedy this at the federal level. So let me turn to Stephanie and ask her to give us a little bit of a idea of what the Healthcare Workforce Coalition is prioritizing.
Great. Thank you so much, Sue. And we're so honored to have Lutheran Services be a part of our coalition. We are a newer, I guess we're now coming up on the 1 year mark since we launched. And really the intent behind this coalition was we have a very diverse group of folks in the healthcare, universe, working on a variety of issues. And we saw that we were all kind of had the same concerns and were focusing on a lot of the same solutions. And so we brought together this diverse group of stakeholders. We have everyone from folks in the education space to folks like Lutheran Services, the Hospital Association. We have provider groups. So we were able to bring a unique perspective when we go to the Hill and talk to legislators, but we're also able to leverage that diverse knowledge. So on launching this coalition, we really wanted to focus on we looked at it as a three-legged stool, with education being one part of that stool, pivotal, workplace and retention being another, and then the final piece would be the international piece. So I'll start with the education piece. The coalition right now doesn't have a specific legislative ask on education, but I think we've got some interesting ideas leveraging the knowledge and insight of our members. We look at this problem, and it's across a continuum. So it begins with one of the big problems that our members have found in the nursing education world, and the healthcare education world in general, I should say, is especially since the COVID-19 pandemic, that learning loss that we've seen has really erased decades of progress, particularly in reading and math among America's youngest learners. And that's, as you all know better than I, critical for success in healthcare education. And actually, according to a survey from one of our members who's in that education space, the most cited reason for students delaying or foregoing applying to a nursing program was a lack of academic preparedness. So that's something that we want to deal with. It's not necessarily in that healthcare policy space. It's probably more in the education space, but recognizing that as a real issue. And that has contributed, that lack of preparedness has contributed to high attrition rates among nursing students and new graduates. We're also seeing higher attrition rates at medical schools. So it's a really serious issue that we need to deal with. As Sue referenced, there's also a real faculty shortage. We have a number of, we have a lot of folks leaving the field, retiring, and so we're unable to have the faculty to really staff to be able to educate the number of folks that we need. And there's also just limited capacity in our programs. I think medical schools have only about a 7% acceptance rate, and nursing schools turned away about 78,000 qualified applicants from baccalaureate and graduate nursing programs in 2022 alone. So we need to find solutions that strengthen the pipeline. And we're looking for really investments in education programs to train the next generation of allied health professionals and nurses. One policy idea that we've been kind of discussing, it came as news to me, probably not to you all, but none of the medical careers, nursing or physicians, are considered STEM. If there's an opportunity at the agency level, like Department of Education, actually National Science Foundation, to open that up, that may allow for more grants to these colleges, allowing them to hire more workers, to pay their educators more. It's very difficult, for instance, in a nursing school, to get a new educator when they make more in the field. So those sorts of things are ideas that we've been kicking about in the education space, but it's going to be critical shoring up that pipeline in order to ensure that we have the workforce that we need going forward. The next big piece that we're looking at is really that workplace and retention space. We're seeing healthcare workers at record, with burnout at record high levels. We have, with those boomers, as against to reference retiring. We're also seeing increased workplace violence and heavy workloads because of the shortage. We're losing a lot of folks. So making sure that workplace is safe and supportive, those are things that we think are critical to our healthcare workforce. One bill that we're excited to support, it's the SAVE Act. That's Manchin and Rubio bill in the Senate, and Bouchon and Dean in the House. So it is a bipartisan, bicameral bill. And what it aims to do is protect hospital employees from violence and intimidation in the workforce. We've seen, I think we learned that 44% of registered nurses report that they've experienced physical violence, and 68% have reported that they've received verbal abuse during the pandemic. More than 80% of emergency physicians report that the rate of violence in emergency departments has increased. And so what this bill would do would really subject anyone who knowingly assaults a hospital employee or contractor or interferes with the performance of their duties to fines and, possible even imprisonment. It would boost the capacity of hospitals to enhance their security systems and procedures to more effectively coordinate with law enforcement by establishing a grant program there. And it's really the idea behind it is this notion that no healthcare worker should worry for their life while trying to save the lives of others. It's an important and necessary piece of legislation to ensure that our healthcare workers can carry out their duties without fear. So we are standing strongly behind that bill. It's now got significant support. We've in the House, we saw a great number of folks. I think we've got over nearly 118 co-sponsors in the House, and we've got 5 co-sponsors and 1 original in the Senate. But that's an important piece of legislation, and we're hoping to move that forward. It's actually in the judiciary space, interestingly enough, even though it's healthcare, because it deals with that law enforcement area. It's in that space, but we're proud to support that one and think that's critical for workplace and retention. The next bill that we're looking at in that area is Dr. Lorna Breen, which is many of you may be familiar with the Dr. Lorna Breen bill, but it basically opens up grants to hospitals to help support the mental health of their workers, and I think that's critical to that bill is really critical to helping support our healthcare workforce and giving them the support that they need. This is just a reauthorization of that bill, which passed overwhelmingly several years ago. It's passed through the House. It looks like it's positioned to move in the Senate. It just needs basically what's known as a legislative vehicle. It's probably not going to work as a standalone. And then, but that's an important piece as well. And then the final kind of area that we're looking at is the international side of things. We know that it's not a panacea, but when we're facing such critical healthcare shortages, making it allowing for those folks, those qualified nurses, getting those qualified nurses that we can here is so important. I think I don't want to talk too much about it because I know we're so lucky to have Ryan from Senator Kramer, one of our bill sponsors, on the line. But this has been critical and probably the first bill that our coalition got behind. And it's critical to allowing those nurses to come in. And I think one of the things that we've heard, Ryan, I'm sure you have as well, is, there are those folks that have concerns about, immigration as a whole. And I think one of the things that we've tried to do is really separate these. This is different. This isn't about the border. This is about bringing in those qualified nurses to take jobs that we just don't have the folks to do here in this country. So it's just a nursing recapture or a visa recapture bill, recapture 25,000 unused immigrant visas for nurses and 15,000 unused for physicians. I won't get into it too much because I know Ryan will talk about that. One other piece on that international side that I'll just note and then turn it back over to you all is there have been some efforts also at DHS to redefine nursing as STEM there. In 2016, DHS put out a regulation that said that nurses and others were specifically not STEM. But ICE has a process where anyone can apply to become STEM, and that would actually it wouldn't be probably as impactful as HWRA, but it could allow foreign nursing students who otherwise would have to leave as soon as they graduate to stay for 2 years if nursing was categorized as STEM. So I think that those are kind of the three big areas that we're looking at: that education, workplace and retention, and STEM. And there are a lot of efforts underway on Capitol Hill and within the regulatory agencies to address those.
Thanks so much, Stephanie, for that great overview of some of the priorities of the Healthcare Workforce Coalition. And as you said, I'm delighted to introduce Ryan Kenyon, who's joining us from Senator Kramer's office from North Dakota. Ryan, thank you so much for being with us. And let me turn it over to you to tell us a little bit about some of the work that you've been doing in support of legislative proposals like the Healthcare Workforce Resiliency Act.
Perfect. That sounds great. Thank you, first of all, for having me. Just going to follow up on a few of the things that you mentioned, Sue, and also Stephanie, just starting with, I think, over the past couple of years, certainly the last 2 to 3 years, as we were meeting with constituents and leaders here in DC and back in North Dakota, one thing became perfectly clear, that all employers were dealing with a pretty critical staffing shortage. And that was true of most industries, but it was particularly challenging for those that were in the healthcare space or in any capacity had to hire nurses. And as facilities and folks were trying to recover from the challenges created during COVID, a lot of them still trying to get back to where things were prior to that. Those challenges have sort of been compounded by a lot of recent actions from the federal government, probably most notably with the CMS minimum staffing standard that you mentioned, which essentially acts as a unfunded mandate requiring new staffing requirements for facilities that have already had a lot of difficulties in finding the available staff in their communities. And I won't spend a ton of time on it, but just want to touch on a few of maybe the bigger components of that rule, and probably the most controversial portion of that would be the 24/7 RN requirement. Just sort of as the name suggests, it will require an RN to be present in a facility. And I think that in particular will be very challenging for disproportionately impact rural and smaller facilities as they try to manage dealing with that. And then the rule creates a new hours per resident per day metric that imposes some more specific staffing requirements amongst the various nursing staff that may be present in a facility. And just at a high level, the senator has been on just about every bill, letter possible in relation to this rule. For starters, he's been an original co-sponsor of the Congressional Review Act, which would directly overturn the CMS regulation. He's co-leading a bill with Senator King actually goes through the Veterans Affairs Committee, which would require the Secretary of the VA to examine the rule. In all of these letters and bills, I would just say have been very closely tied to, what is the impact in access going to be for seniors? I think most people would reasonably anticipate this is going to greatly reduce the access that seniors are going to have for care and options, right? Circling back to the VA bill real quickly, it would require the VA to look at this rule, assess what is the impact going to be on access for seniors and veterans. And that would apply, they would look at both like state veterans homes, for example, as well as those community facilities, which a lot of them are serving veterans daily and of course would be subject to the CMS rule. Just circling back to nursing more specifically with the Healthcare Workforce Resilience Act, and everything Stephanie mentioned, I think was spot on. And this bill is a bill that my boss is the Republican lead on with Senator Durbin from Illinois. High level, the bill seeks to recapture unused employment-based visas, specifically for nurses and physicians. The bill is a very bipartisan bill, has 20 co-sponsors in the Senate currently. It's split basically down the middle in terms of Republicans and Democrats supporting it. In specifically would set aside 25,000 visas for nurses and then 15,000 for physicians. And so Senator Durbin, who's the co-lead on the bill with us, he's the chair of the Senate Judiciary Committee, which is currently where this bill sits right now in Congress. That's the committee of jurisdiction for that. And so we've been working pretty closely with their team, looking at what is the best way to not only move this bill through committee, but of course, towards the floor for ultimate passage. And I think, as with a lot of other things at this point, we've reached the time in the year where timing is a really big challenge. We look at the calendar and we have a very small number of legislative days left on the calendar before the end of the year. And on top of that, we have quite a few big ticket items that have left to be done. Just to name a few, we have the appropriations process likely looking like a CR, the National Defense Authorization Act, and a farm bill expiring at the end of this year. So those are just a few of sort of the items that are going to be taking up floor time and attention as we move towards the end of the year. And I think, as Stephanie kind of pointed out, this bill, we've approached the topic, right, as this is a workforce first bill. We've heard the need and demand from facilities really across the country. And unfortunately, since this bill does amend the Immigration and Nationality Act, that's what sort of pulls us into the Senate Judiciary Committee jurisdiction. And naturally, you run into some of the challenges of legislating in the immigration lane in sort of our current political environment. And so those are just challenges that we're navigating, and we're going to continue to push forward. And just to touch on real quickly, I think there are plenty of facilities who are already utilizing this option or looking how can they better utilize, an international approach to hiring staff to meet the demand that they're facing. And I think we've all heard a lot of the challenges in these past couple of years, specifically with the State Department, their issuance of the visa bulletin, the visa freeze, and the delays that's caused for facilities trying to rely on this option. Would definitely say we've looked at the Healthcare Workforce Resilience Act as sort of an immediate direct response to that, and something that at least for sure in the short term would have a pretty direct and helpful impact for facilities. And so maybe I'll just leave it there and hope that provides some context, and we'll stick around for maybe some questions here at the end.
Yeah, thank you so much, both to Stephanie and to Ryan. We have two fabulous members joining us, including Wanda Harris and Kelly Dobner, that we'll hear from shortly. But while we're on the legislative/regulatory piece, just wanted to offer this opportunity. If folks have questions, anything, clarifying questions, anything you heard that's not clear, or any questions for our speakers. We have some prepared questions, but happy to hear from members. If there's anything you would like to ask and follow up.
I know one question we've had, and I know we've heard this from some of our members as well, and from our board members, is what can we do, and we being us as the policy team, but all of our member network across the country, how can we better help move some of these proposals along? And I know you, especially Ryan, have talked about some of the challenges and pitfalls of where these bills are referred and who needs to take them up. But recognizing we're in this funny time of year for the Congress, and this Congress is almost adjourning, but how can we be better at advocating for these things?
Yeah, I would just offer a pretty basic response to that in terms of, I think immediately as we move forward, the biggest thing we can do to sort of bolster support for it is expand the number of co-sponsors we have on the bills. And so all the members who have facilities, located across the country, who are represented by different members of Congress and senators, I think having those conversations with all those various members and offices who may not currently be supportive or co-sponsor of the Healthcare Workforce Resilience Act, it's helpful as you are meeting with them to just, share your story, the challenges that you're facing, and how this legislation in particular would be helpful in addressing some of the immediate workforce needs that you're having. And I think as that process progresses, hopefully we're able to expand the number of supporters and keep pushing the bill forward.
Thank you, Ryan. Other questions? Oh, Ryan, you have a question, please.
Hi. Yeah. Hi, Ryan. Good to see you. Thanks for being here. Back in earlier this year and visiting and talking about all these issues. And one of the things I was thinking about in follow-up to the last comment, should we continue to advocate directly to CMS for these changes? I mean, there was that open period where we were nationally, I think there was 50,000 comments received, and it all went in one ear and out the other, because then the final rule is proposed and it's worse than it was before the comment period. So, are these things we should keep doing and wasting our time, or is there a better route here?
Yeah, I mean, I think at the end of the day, the more noise we make on this issue to CMS is helpful. I totally understand where you're coming from. It was a very frustrating process for a lot of us here as well, where we shared very similar concerns to you all in letters, in bills, and watching that process from the proposed rule to the final rule stage very much felt like what you described, right? Those comments were not heard or seen or acted upon, even though all your members who are on the ground facilities working in the space were letting them know what the impact would be. I guess from my perspective, I think it only helps us as we continue to sound the alarm as well, to have as many voices in that conversation as possible. But it's good to see you again, and glad you could make it on to the webinar, and look forward to continuing working with you.
Okay. Yeah. Thank you.
Any remaining questions for Stephanie or Ryan? And thank you. Then I'll just say thank you to both of you for providing this great overview. We're delighted to continue to work with you on these issues and appreciate your time and please let us know how we can continue to help. And for our members, there's a link now in the chat. If you don't know about the Healthcare Workforce Resiliency Act, or you do know and you haven't taken action, please join us in making sure your voice is heard on this important issue among the others that Stephanie and Ryan shared today. Thanks to you both. I'm now going to turn it. Thanks, Stephanie. I'm now going to turn to our wonderful colleagues within our Lutheran Services in America network. Today we have with us Kelly Dobner from Samaritas and Wanda Harris from the Evangelical Lutheran Good Samaritan Society. We're going to hear from them a little bit about their respective work and efforts as members in addressing workforce challenges. First, Kelly is going to talk with us about work she is doing in Michigan through the workforce lens, both as it relates to housing and immigration. So let me turn it to Kelly to share some remarks with us. Hi, Kelly.
Great. Hi, thank you so much, Sue. It's great to be here with everyone and really important conversation. I will keep my remarks fairly brief with this, but tying most specifically to what you were just talking about, Stephanie and Ryan in the healthcare space, Samaritas made the decision 2 years ago to actually exit the senior care space, largely for a lot of the reasons that you all described and that we're gathering around today. You know, from a workforce standpoint, we were really struggling to recruit and retain talent. And we were spending a lot more money on agency staff, in particular, to fill in those gaps of FTEs in all of our senior living communities. And we had 5 across the state of Michigan. And they ranged anywhere from independent living, skilled nursing, memory care, and assisted living. And so that was a huge undertaking for us as an organization. And it almost cut us in half in terms of revenue and staffing resources. At the same time, we were making the decision of how can we best serve our mission and live out our ministry in a different way, still serving the senior population. And so we turned to another important area that we've been serving the state of Michigan for the last 50 years, and that's affordable housing. So we have 17 communities across the state of Michigan today, and 13 of those serve seniors specifically. And it's a very different workforce than we need in our other business, in our other line of service that we recently exited. I will tell you, it's been a 2-year process, and November 1st marks the final closing date for that 5th community. So, we recognize that this is a bit of a trend for a lot of the same reasons that we're talking about here today. So that was just one piece that I wanted to at least cover, and how that impacted an organization like Samaritas, who we're celebrating 90 years this year. We've been around for a long time and been doing providing the senior care work for quite some time as well. And we were no longer able to compete in the ways that we needed to deliver the services that we're committed to. So, but that doesn't alleviate us from workforce challenges as an organization. That leaves our work today is in 4 core areas of impact, and that's child and family services, so the whole social worker space, which I'll talk about in a minute, substance use and addiction services, refugee services, and affordable housing. And so the social workspace in particular, because that makes up one of the biggest areas of service that we have. It's refugees and child and family. And we have seen a significant decline in people going into social work. And I've talked with many of our members, so I know that I'm in good company, bad company, at least similar company, and in having these challenges with workforce. There are a little over 200,000 jobs just in Michigan alone that are vacant today in the social work space. We are seeing kids come into care with higher acuity needs in programs that are not funded to support those kind of needs. We are seeing families in crisis that need someone to walk alongside them, providing them with education and resources, with pretty traumatic experiences. And that's what our social workers are seeing. We're seeing people not only not get into the industry, but they're exiting the industry as well because of secondary trauma, as a very significant issue, but also the pay. We don't see that keeping that COLA, I guess, keeping pace with inflation on a regular basis, let alone any kind of inflated inflation that we're all seeing today. So we've been doing a lot of work in a couple of ways. A lot of advocacy, working with our legislators very closely so they understand the issues and the impact if we don't do something to lift up this industry and properly fund it, and the impact that it makes on our community, both from a financial standpoint and a social standpoint. You have to be able to tell that full story and be very data driven in doing so. We're also lifting up the social work industry at the same levels as our education industry and our medical industry. So, Stephanie, when you were talking about some of those issues that are hitting our healthcare space, we're also seeing that in the social services space. And when we're talking about funding opportunities and support on a legislative side, those aren't necessarily the first to be funded opportunities, right? And so when we can make the case and demonstrate the parallels across these industries for maximum impact and holistic service, that's what we're trying to do, because we're seeing people exit all of those spaces and not coming into them. So legislation, lifting up industries, and at the same time, we are also working on our own professional development and culture development within Samaritas alone. How are we attracting talent? How are we retaining them? We're working closely with DHS on recruitment programs with colleges, universities, and high schools to create incentive programs that will give $5,000 per semester to the students if you stay in Michigan in the social work space for a period of time after graduation, and trying to rejuvenate the talent that is coming into that space, and then the professional development opportunities and culture development once they land at Samaritas, and being able to provide that career pathing for them. The last thing I'll say with all this, because you heard me talk about affordable housing and that area of expertise that we have, Michigan is very focused on population growth right now, and immigration policy is at the center. Well, I can't say the center. I want it to be more in the center of that conversation, but it is a part of that conversation for sure. And regardless of that, we are focused on bringing people into Michigan and retaining them, but we don't have the infrastructure in place to do so in terms of affordable housing. And so that's where we're spending our time, is being very solutions oriented, outcomes driven, and issue based, to be able to not only lift up workforces that we so desperately need, but then being a part of the answer to build the infrastructure to be able to house workforce. And I get calls on a daily basis from our corporate partners that aren't even in our space in any way, that say, I have 2,500 employees I'm trying to bring into this community and I have no housing. I know you offer affordable housing. Can you build something for my employees to come and live and work and play as part of this community? It's a significant crisis, and we provide an intersection really for all these populations and issues to come to light, and something that we can do about it. And I realize I could talk for hours, maybe even days, about all of this, but I'm going to pause my comments at that point, Sue.
Well, Kelly, thank you. I mean, you just created such a beautiful, unfortunate, but beautiful parallel, right? And how all these issues intersect, and that we can't look at them singularly, right? We have to have a sort of a holistic idea of how all these things intersect, and holistic remedies, right? So thank you. Wanda, I'm going to turn to you next to tell us a little bit about all your work and efforts at Good Sam. Thank you for joining us.
Thank you, Sue. I was interested in listening to Kelly, because like Kelly and her organization, the Good Samaritan Society has had to make adjustments When I started working here in 2021, we had 240 locations in 22 states. Now we are in the process of implementing a strategy. We are actually shrinking our footprint, which is pretty well known, down to 7 states and probably more like 173 locations. So access is certainly an issue. We primarily operate in the senior care, senior living, long-term care, post-acute space. But it is harder and harder to operate in this environment because of the workforce challenges. We do have an advantage at the Good Samaritan Society with our affiliation with Sanford Health. Sanford is one of the largest rural health care providers in the United States and provides us with some sophisticated human resources solutions, products, and services that we can deploy. But we do rely on our public policy officials and efforts to help sustain everything we try to do for that workforce growth and sustainment. One of the big things that we are focused on is our internationally educated nursing recruitment program. So really thanks to Ryan and everyone in Senator Kramer's office and Senator Kramer for that advocacy for immigration in the healthcare space. We have hired 26 nurses over the last 2 years and have 126 offers out to internationally educated nurses that have been accepted. However, it will take from 2 to 4 years for all of those nurses to make their way into our facilities. And currently, across our system, we have 1,300 job openings. So it is just a drop in the bucket, but it is something that is crucially important to our workforce development. We have also started working through the Welcome Corps at Work through the U.S. Department of State and HHS joint effort. Individuals arrive through the U.S. Refugee Admissions Program, and this program matches U.S. employers with skilled refugees in need of resettlement. And we just started this program in collaboration with Lutheran Social Services. So we're hoping we can also use that to sustain and grow our workforce. And then I would say the other thing that is very important to us is really keeping our finger on the pulse of what we need to do to attract and retain employees with all of the other competition we have, not just in the healthcare industry, but in other industries. So we're paying really close attention to any type of policy or programming that makes healthcare an attractive place to be. I've just started looking at some of the talk around no tax on tips. Well, healthcare or not, that's our workforce. And what might make someone turn away from healthcare and go into some other service industry where they can receive tips is something that's on our mind. So we're trying to really promote healthcare as a mission driven calling for people. We frequently survey our people. We deploy engagement surveys twice a year, and we find that what keeps them here and what attracts candidates to the Good Samaritan Society is our focus on mission and our culture of providing health, healing, and comfort and caring. It really does resonate to people who want to provide a caregiving type of service to their community. And I think that's really important. So anything that we can do from a policy or an advocacy standpoint that really ties hearts and minds together to a caregiving part of healthcare, that calling that is healthcare, has been really important to us. So I'll pause there and just see if anyone has any questions.
I mean, Wanda, thank you. I mean, that was incredibly illuminating. And Kelly too, right? Just to hear about all the shifts you've had to make in your business, the way you run it, right? The way you can operationalize it. So much transition, and then also just so much for sharing so much about how you're working to remedy this. And so let me open it up now to ask colleagues if they have questions.
And feel free to use the raise hand feature if you want us to call on you directly, or we have a couple of questions that sparked for us while our members were talking. So two things I wanted to ask. One, oh, actually, I'll let Justina go ahead. Go ahead, Justina.
Hi. Okay. So, firstly, thank you to the presenters. It's been really great. My question is to Kelly. Um, so you mentioned about your talent search and um, providing $5,000 to reaching out to students and college students and high school students and trying to work with them and getting them in the workforce earlier. So I was wondering if, apart from the $5,000 program, if there's anything else you guys are doing to like encourage students to come into the field more. And I'm asking this because if the workforce is just waiting for people to be ready and then employ them, it's going to be harder. But if you can get the incentive out there to students and help them grow in that career, it's easier for them to come. So I'm asking in light of, are you supporting like a particular major in college that will encourage students to, start in that track early in their career and then work up to you?
Definitely, definitely, and truth be told, we need to do a lot more investment in that space. Manpower in particular to be out there with recruitment efforts as well as our own professional face out there, right? Because I always like to have someone from HR, someone from the social work space to be able to hit both sides of those questions and the recruitment message. So yes, we are doing a little bit of that now. We need to do a lot more. And this is a newer program with DHHS and within Michigan and our universities. They've put $1.7 million towards it, broken up into those $5,000 increments. But again, I think there's a lot more that needs to happen there. And that's why, to your point, we do want to start early and why we're targeting high school to be able to start teeing that up, planting those seeds, and then be available as much as we can through regular presentations to recruit. Because it's not enough to just open your door and invite people to walk in. You have to go and intentionally recruit in areas that you want to see join this force and be a part of this industry. So we're doing a lot of that, but we need to do quite a bit more and get them early. And it starts at least in high school for us. Good question.
Sarah, were you going to ask a question?
And so one that I had in mind, and then one that kind of came up as Kelly was speaking. So one kind of for both of you, but what do you think is the most important piece to focus on for retention, and kind of in hand with that is, how are you innovating to create that culture where people want to stay, not just, you're giving them incentives, but the internal incentive to want to stay. And then just while I'm off mute, Kelly, I think other members, your fellow peers would love to hear maybe a little bit more about, you mentioned your corporate partners and the folks that you work with to help their workforce needs, and you're kind of working across the community and leveraging the housing you're doing and helping them with workforce, and it's all kind of a cycle. So would love to hear some more about that.
Sure. Yeah, absolutely. Besides incentives, it really is developing the culture that you want to see at your organization. And there are a couple of pieces that we're looking at in particular. One is workload alleviation. And in full honesty, we have not mastered that at all. We work in a very challenging industry or industries. But that is one thing we are hyper focused on, is how do we alleviate that workload so people don't feel that burnout, in addition to that secondary trauma that we're talking about with this difficult work that we're already in. So how do we work or alleviate workload, and how do we demonstrate appreciation? We did a survey and then a follow-up exercise with our top 250 people across the organization. When I say top, I mean supervisors and higher, and in an all-day retreat. And we did a lot of small group work. We did a lot of whiteboarding. And what we found, what people are really striving for and thirsty and hungry to see, feel, and experience is appreciation and going. And it sounds so easy, right? But when you've got the everyday hustle and bustle, sometimes it's difficult. Forgive me. Sometimes it's difficult. I'm going to try and talk a little louder, and forgive me. He's literally way down the hall in the other side of the house. It's like an echo chamber. But is to take the time to demonstrate that appreciation and putting some things in place that are turnkey for our supervisors to be able to drop a little note. Work Tango. Do some research on Work Tango. That's a platform that we're using to help facilitate some of that work as well. So those two things in particular around our culture development is helping a lot on that side.
And Wanda, would you want to add anything to that?
Yeah, I would say retention is absolutely critical. It's just as important as recruitment. Not having the job opening to begin with, and certainly impacts the quality of care that we can provide. What we have found is a little different than what our organization was used to, and that is involving the entire team. So peers are so important. And I think back to, I wrote some notes when Stephanie was talking about education. We need more preceptors. We need more mentors, because we have found that when we encourage that peer-to-peer development, then our retention really goes through the roof. It's really the most important thing. The other thing that which goes hand in hand, that we pay attention to, is paying very, very close attention to new hires in their first 90 days. And again, assigning them that preceptor, assigning them that mentor, and making sure that our preceptors and mentors have the skill set to perform those duties. And then finally, rewarding. You've heard about retention bonuses and hiring bonuses. Well, we've started to provide bonuses to the mentors and to the preceptors. If the people whom you are guiding along are still here with us after 90 days, you get a bonus as well. So I think that's part of the whole package, is making sure that we care for those preceptors, those mentors, those folks that we call it bubble wrapping our new hires in those first 90 days. That's really been important for our retention and engagement efforts.
Thank you. And sorry, if I know we're about to wind up, but if folks can mute themselves that aren't talking, that would be great. And I think just a final question to both of you. If you could give one piece of advice, either to our colleagues that are with us, Ryan and Stephanie, or to your peers, one thing that you think could start to change this conversation, just not to put you on the spot, but just one thing that you think you'd want to leave folks with today would be great. Wanda, why don't you go first?
Sure. I would say it is all about access. So going back to the rural nature of our footprint, and my own father receives services at the Good Samaritan Society, and I just worry about other families out there who may potentially lose access. And I think in all of our advocacy efforts, involving our own employees, talking about our own peer and our employee relationships in delivering that message, that's what we're focused on. And I think that's what's most important.
That's a good one.
Thank you, Kelly.
Yeah, that's what I would say is lifting up your voice, right, in whatever way you can, with the community at large, to have a collective base and help you deliver that message, and working with our decision makers, our policy makers, and bringing to light the heart of what we do, but the impact and the business case for what we're doing and what will happen if we don't. And I think that's across the board on workforce development, no matter what industry that you're talking about.
Well, we're so grateful, Ryan, Stephanie, Wanda, Kelly, for all of your time. This was robust enough. I think we're going to do a follow-up on workforce looking at different dimensions and a little bit more depth that were raised today, because I feel like we just skimmed the surface, but appreciate so much. And again, if you haven't already taken action on Healthcare Workforce Resilience Act, no time like the present. And if you have any questions, please reach out.
And we're doing the final poll.
Yes, thank you, Sarah. So Bill was kind enough to bring up our final poll. Okay, so this is meant to be what's changed. Did you learn anything today? And so we'll give you one more minute to finish the poll if you haven't taken it. All right. Well, it looks like we changed what this looked like from the beginning. And I think this does merit, right? Some folks are still feeling a little somewhat or very uninformed. So we'll keep the dialogue going. And so thank you so much to everyone for joining us today. We'll have a recording if you want to share it with anyone. And thanks again. Take care.